Hi guys, thanks for watching this video with Ask a Nurse Practitioner. The topic that I'm going over today is about breastfeeding and birth control. Specifically, can breastfeeding be used for birth control? The answer to that question has two parts. The first part is yes, breastfeeding can be used for birth control. Breastfeeding works well for birth control if you are breastfeeding at least every 3 hours throughout the day. That's consistently every 3 hours. So even when baby gets to a point of sleeping for 4 or 5 hour stretches, you still have to breastfeed every 3 hours in order for that to be an effective form of birth control. If you are going beyond 3 hours, it will no longer work. If you are starting to supplement with formula, breastfeeding will no longer work as a form of birth control because it just doesn't work well enough to suppress ovulation unless you're doing that every 3 hours with exclusive breastfeeding. For those who are pumping rather than breastfeeding directly at the breast, it still works for birth control as long as you are breastfeeding or pumping, at least every 3 hours. That is around the clock, 24 hours a day. You have to pump in order for that to be effective. If you are doing both of those things, pumping every 3 hours, and you're doing that around the clock, it will also work well for you as a form of birth control. Now, with using pumping or breastfeeding, it's only effective as birth control for the first 6 months. Once your baby reaches 6 months, it's just no longer effectively suppressing ovulation in order to work as a form of birth control. So at that point, you would need to talk to your healthcare provider about a different form of birth control if you're not ready for another pregnancy. Feel free to drop a comment if you have any questions. And thanks for watching this video with Ask a Nurse Practitioner.